All right. Well, if our folks are all set, we can get underway. I'm Ben Truman, the communication folks here at Health Department. Again, please mute your lines if you are not on and turn off your camera unless you're asking a question. Thank you. Here with Health Commissioner Dr. Levine, Secretary of Agriculture Anson Tebbetts, Deputy Secretary Alyson Eastman, and State Epidemiologist Patsy Kelso. Talk about the current outbreak. Dr. Levine, if you are ready, we'll turn it over to you.
Thank you, Ben. Many of you who follow our data updates noticed a large increase in cases reported today. The majority of these cases are tied to a new outbreak we are investigating at a farm in Addison County. The health department learned last week that a worker at Champlain Orchards had tested positive for COVID-19. Our teams quickly began our work to provide health and isolation guidance as appropriate and to trace contacts. We have been working closely with the owner of the orchards and the Vermont Agency of Agriculture in our investigation. Because there was a risk of spread among the farm workers, we decided to offer testing to all farm employees over the weekend. As a result, we've now found 26 cases tied to this outbreak. Contact tracing is underway. At this time, the outbreak is contained to the farm, and I want to emphasize there is no known risk to the public. It is also safe to eat apples and other products that were grown or produced by the orchards. If you've been apple picking in the past couple of weeks or visited the farm stand, you are not at risk either. I want to thank the farm owner who is complying with all COVID-19 public health recommendations and for quickly moving to put measures in place to keep anyone who may be contagious from coming into contact with other workers on the farm. This cooperation and dedication to the health and safety of their workers is essential to preventing further spread of the virus. The orchard owners and state agencies are working to provide these workers with the critical supports they need to quarantine and isolate safely, such as food, housing, and other needs. I also need to remind everyone about the nature of this virus. It spreads quickly and easily, especially among groups of people who live close together. COVID-19 spreads because it is a highly contagious virus. It is in the air we breathe. Unfortunately, I have seen various facilities, businesses, travelers, ethnic groups, and other groups face stigma over the course of this pandemic. And I call on Vermonters again to focus on the disease and how to keep it at bay where we can, rather than creating fear, rumors, or placing blame. You can all help by protecting the privacy of people seeking health care and of those who may be part of any contact investigation. Communicating accurately about risk and how the virus spreads, and speaking out against negative behaviors and statements, including those on social media. And importantly, make sure you know how to keep yourself and those around you safe and prevent spread of the virus. Go to healthvermont.gov/COVID-19. In closing, I want to thank the teams that came together quickly over the weekend as part of this response. We will continue our tracing work in the coming days to contain this outbreak. Now I'll turn it over to Secretary Tebbetts to talk more about the Agency of Agriculture's role.
Thank you, Dr. Levine. Anson Tebbetts with the Agency of Agriculture. Also joining us on the line is Deputy Alyson Eastman. Deputy Eastman was part of the team that was at the orchard this weekend, working with the health department. Just a couple of things. This is a very, very busy time of year at the orchard. It's been an orchard that's been around with the current ownership since 1998. And this is your standard, very busy, big employer in Addison County, where they pick apples for wholesale, but they also have a retail operation as well. So it takes a lot of workers. It takes a lot of time and effort to get the apples picked and harvested on time, on schedule. And we know in the spring, we see the apple blossoms, we see the fruit mature over the summertime. And now is the time, in a very short period of time, where the apples need to be picked and gotten to market. So that's what's happening at this particular orchard. As Dr. Levine has said, the owner has been very cooperative in working with the agency on a number of issues out there. And our main focus right now is the health and safety of all involved, the workers, the employees, and the community. And that's what we're focused on right now, is to make sure all that support system is there. And we are very appreciative with the health department with that. So those are my opening comments, and we're standing by for more questions as they come about.
Thanks very much. If we're set at that point, I've got several reporters who've already said that they had some questions. Folks, when I call you, you know, I never, but the technology is always a little different depending on what you're doing. It's up to you. If you wish to turn your camera on for your asking your question, please turn on your mic for that and turn it off afterwards so that we can keep going. If you didn't let me know you had a question, you can click the raise your hand and we'll call you afterwards. If you have questions after the press conference, you've all got my email address and phone number. Give me a holler and we'll get you an answer. First out of the box is Katie Jickling with Vermont Digger.
Good afternoon. So you said that there were 26 members or workers at the orchard that tested positive. Who were the remaining 7, I believe it was?
I'm not sure what you mean. Who are the remaining?
Were they associated with the orchard, or was it related to the same outbreak, or were those different cases entirely?
Oh, you mean on the daily report of all the cases?
Yeah.
Yeah, no, none of the remaining 7 were from Addison County.
Okay. And what are the quarantine policies for people who come to Vermont to start jobs? And have you had any issues with companies or individuals following those rules?
Yeah, so the quarantine policy is a 14-day quarantine, and workers that come in under this program are all subject to that. And these workers were actually in their 14-day quarantine period.
Okay.
All right, next up is Lauren from NBC5.
Hello. What can you tell us about the people who were infected, and do they have access to health insurance? Or if they were undocumented, how would they go about treatment?
So I can tell you that a large majority of them actually don't have a lot of symptoms. There are programs for them to access, and I might question if Secretary Tebbetts or Deputy Secretary Alyson has information on those programs.
Sure.
Yeah,
Go ahead, Alyson.
Thank you, Dr. Levine. We're currently working with the Department of Health to seek out how they would access health care under the Corona Relief Act. So I don't have definitive answers on that. Happy to follow up as we learn more. The other piece to your question is that these workers do travel through the H-2A program, which is a visa program. So at this particular orchard, there is both U.S. domestic workers and H-2A visa holder workers, so they are documented.
Okay, Lauren, you all set?
Yes, thank you.
Great, thanks. Lisa Rathke, AP.
Thank you. And so are these, can you tell us how many are through the visa program and are they from Jamaica?
Yeah, this is yes, the H-2A program is the main focus of this. And Alyson can probably go through some of the details of how that program works, but that is a federally run program. It's quite regulated. It is, there's a lot of paperwork involved, a lot of work orders and timing and scheduling and so forth. But Alyson, maybe you can just give an overview of the H-2A program so everyone on the line gets an understanding of that program.
Yeah, Lisa, I'm not sure if I can answer your question directly. We'll leave that to Dr. Levine with the HIPAA Privacy Act as to who the individuals are that tested positive. But in reference to the H-2A program, the majority of the workers that travel through the H-2A program for the purposes of harvesting apples do come from Jamaica. Those job orders start 60 days prior to the date of need. The employer would file a job order with Department of Labor seeking to hire U.S. domestics for that employment prior to bringing in migrant workforce. Once they receive their labor certification, they then petition immigration. And once they are approved through immigration, that's when they arrange for transportation. It is important to note that these workers that travel this year prior, to COVID and the operations of how we try to improve process. We did talk with the agent that works with the majority of these employers in Vermont and encouraged that workers travel via plane and have the least amount of layovers, and once at an airport taking a charter bus from that airport to the final destination. And in this case, these workers at this orchard did fly into an airport and did take the charter bus. So they did travel together, which is the idea to limit the exposure.
And so most of the 26 are these H-2A workers.
I'll leave that to Dr. Levine. I'm not sure what we can release with HIPAA.
I think it's fair to say that all of these workers are migrant farm workers.
Okay, and then what about the orchard? Is the orchard open at the moment?
The orchard is currently operating their wholesale with limited staff, and the purposes of meeting with the epidemiology team yesterday with the Agency of Agriculture was to see the operation and discuss what could be put in place to, for safety standards, basically in their warehouse wholesale operation. The workers themselves that did test positive have been outdoor workers, so harvesting crew. So the idea is to make sure that proper procedures are put in place to ensure the safety and spread of the virus. So it's our understanding they'll continue to work with Department of Health as to how they're going to open up both their retail and their wholesale back to the capacity that they are used to running under.
Okay, and just so I'm clear, they had just recently arrived and were in their 14-day quarantine.
Yeah, they arrived on the 14th is my understanding, and their quarantine ended on the 28th.
Okay, thank you very much.
Mm-hmm.
John McCray, Addison Independent.
Hi. Let's see. So one question is, are all the 26 were pickers or were the other workers? It sounds like Dr. Levine answered that one. the other question was, you said that quarantine it is on the 28th, and Bill Shore on the orchard owner on his Facebook said that the worker tested positive 2 days after his quarantine. Does that sound right? That he was out of the quarantine for 2 days before he was tested positive?
That's correct.
So was he tested positive on Wednesday on the 30th? And
I believe he went in for the test on Thursday, and the
Okay.
results came back on Friday. If
Okay.
I'm incorrect, I would hope our health officials will correct me. The days are starting to blur together, John.
I'm sure. Been a busy week. I'm sorry if I missed at the beginning. Are there any other workers quarantine or in a hospital other than the one who was sent to the hospital on Friday?
No.
Okay. This is maybe one for Dr. Levine. I just heard that there was a positive case at Middlebury Union High School. Can you confirm that?
Actually, I cannot confirm that. I'm
Okay.
not aware.
Okay, those are my questions. Thank you.
All right, thanks, John. Reminder to folks to please mute yourselves or turn off your camera if you're not actively on it. Very much. WCAX? Mystery reporter from WCAX? Unmuting, or if you're just calling in, it's the whatever the usual. Hit star six. Yeah, I'm sorry that any of us has to even not remember that anymore is weird. Okay, Malia, Burlington Free Press.
Hi, Dr. Levine. You'd mentioned that people who had visited the orchard leading up to the outbreak don't need to be worried about transmission. I just wanted to see if you could give some more details on how the health department is sure that people who have visited don't have reason for concern, just given the nature of how easily the disease spreads.
Sure. So a big part of that has to do with our contact tracing and knowledge of how the operations work at the farm. Maybe I'll turn it over to Dr. Kelso to explain at least the former part of that discussion.
Sure. The contact tracing team interviews individuals who are infected with COVID-19 and asks all kinds of questions about their activities and how those activities were carried out. And, we've been doing this now for many months and have become really good at eliciting the type of information we need to make an assessment on whether someone had close contact that might be a risk for exposure versus incidental contact. For example, at a retail establishment like a grocery store, we typically do not consider someone to be exposed if their only interaction with another person was, checking out at a grocery store. So we ask a lot of questions and get a lot of information. In this case, it was also really important for the EPI team, along with the Agency of Ag, to be at the orchard and see how the operations are run, see how the workers do their work. And, based on all of the information we gathered, determined that there's no chance that we could identify that a member of the public who either went to a pick your own opportunity at this orchard or visited the retail section could have had close contact with someone who is a case. And I'll add, Dr. Levine's opening statement indicated that, contact tracing is ongoing. It's largely complete at this point. So we don't expect to learn additional information that might indicate that there was a risk to the public. We do not expect that.
Great, thank you so much.
And Mike Donahue.
Thanks, Ben. Couple of clarifications. One, I'm just trying to confirm. So they flew into an airport. Are we saying that all, or are you saying, not we, they were all on the same plane at the same time on the same flight, or did they come in on different flights and get to this airport at different times?
No, it's our understanding they all flew together as a cohort and got on the charter bus again as a cohort, and the bus dropped them off directly at the orchard.
And which airport did they come into?
They flew into JFK.
Okay. And were they the only ones on that bus, or were other people going to other orchards on that bus?
It's my understanding they were the only ones on that bus.
Okay. And are any other orchards being tested at these days?
Not at this current time. We had an email this morning discussing should the need arise, and also as to how many H-2A workers would be entering in the state. I did email a response back to Department of Health that there are no more H-2A workers traveling into the country for 2020. I believe the first workers will come in February of 2021.
Has the excuse me, has the bus driver been contacted?
I'm not sure. The travel service that made arrangement for that transportation was contacted.
And
You don't know.
this is Patsy. Just to be clear, the bus driver would only be contacted if it was determined that someone was potentially infectious during the bus ride. So it's not necessarily true that the bus driver would be contacted.
Not even as a courtesy.
No.
In Anson, you said that the Champlain Orchards is a large employer. Just exactly how large are you talking?
Alyson, would you have an idea roughly how many people work there during peak times?
Right. We'll be specific and talk about this is their peak seasonal need. And I believe the owner had mentioned that last week they had around 90 folks on payroll.
And all of those have been reached out to?
Hi, this is Patsy.
Thank you, Patsy.
All of those who we think we needed to talk to because they could have potentially been exposed have been reached out to.
Okay, and last question. Dr. Levine, John McWright asked a question about Middlebury Union, and I didn't quite get the answer. Are you can't answer or you won't answer?
No, I'm answering honestly. I am not aware of a case at Middlebury Union High School. That doesn't mean one may not show a positive test today that is coming out of our lab. I just am not aware of any at this point in time.
Okay, I just wasn't quite sure whether it was a can answer, because you do sometimes identify places. Obviously, you're identifying Champlain Orchards, but the slate company down in Fairhaven you didn't identify. So you sometimes pick and choose giving out information. That's the only thing I was trying to figure out.
Understood.
Thank you.
Devin Bates, I believe you had a question.
Yes, thank you. Can you hear me?
Yes, thank you.
Yeah.
This one is for Dr. Levine. All along, of course, there's been the key message for people not to let their guard down, but this seems like a particularly important time. You're seeing outdoor recreation starting to wind down towards the end of the fall and into the winter, rising cases in Maine and other nearby states. Could you just talk about the sort of juncture we're at right now? And then as winter goes on too, there's ski areas and potentially more tourists coming in from out of state. What are you looking at for these next few months as we're starting to see these sort of signs around us?
Sure. You're right. What we've been telling everyone is that not just we, but national figures telling the country, like Dr. Fauci as well, that as cooler weather prevails, people are going to be more indoors and not have the protection, if you will, of being outdoors as much of the time as a percentage of their total time. So it becomes increasingly important for everyone to make sure that not only are they adhering to the physical distancing rules and the masking, but at the same time be cognizant of the fact that when they are indoors, it could get crowded depending on the setting they're in. So to obviously be very on the alert for spaces that might be crowded and plan accordingly. The reality is we're still following all of the same metrics that we follow every week for months and months now that have to do with numbers of new cases, have to do with our testing and how adequate our testing is and what percentage of our tests are showing positive. Looking at our healthcare system to make sure that we're always aware of how much it's being utilized, either by hospitalized patients or by patients reporting to urgent care settings or emergency rooms with symptoms. These are all metrics we follow constantly. And I just would say that if we did not have the cases today that we're talking about here, the report last night would have said something in the realm of 7 cases. I want to remind everyone that as I show our graphs every week at our press conferences, what we call our epi curve, there are very low numbers most of the time, but there are periodic spikes in the data. None of them spikes that are in anywhere close to March of this year. However, we expect all along that we will have clusters of cases, sometimes outbreaks of cases. This does not mean that overall the state is doing worse in any way in its overall experience with COVID. There are times that these outbreaks occur and we are expecting them. Just like as we opened up various sectors, we said that this gives our population an opportunity to be closer together and involved in activities that they may not have been involved in prior to that sector opening up. So again, the game plan, if you will, really hasn't changed significantly at all. And I don't want everyone to think that this new set of cases that we reported last night means there's a sudden departure from the state's performance overall, because that would not be true.
Henry at BPR.
Thanks. Can you hear me?
Yes.
Yes, we can.
I just want to ask, you've sort of answered this, but it sounds like you've done a fair amount of contact tracing. But just to be completely clear, do you expect more cases to come from this outbreak, connected to this outbreak at Champlain Orchards?
This is Patsy, it's quite possible. For the cases that we've identified to date, we have done thorough contact tracing. What is not complete yet is ongoing testing for people who we know were exposed. So, there may be someone who was identified as a close contact at the work site who now needs, to be tested. We're offering, I think, testing tomorrow on site and potentially again, just to make sure we identify any cases that might still yet result from these initial cases. So we may find additional cases and we may need to do additional contact tracing based on those new cases. But for right now, the contact tracing has been completed. We'll continue with our testing plan there.
So, just in terms of the those that you'd be testing further, would that be additional employees of Champlain Orchards?
yes, there are additional employees who are not cases, but who may have been exposed. And so we'll be offering testing at the work site.
Thanks.
All right, Andrea, 7 days. Andrea, sorry.
Hi, thanks. No worries. I just want to check since these are H2A workers, is the spread of the virus at this point, the positive cases, isolated to a specific group living situation? Are there multiple living situations involved?
I'm happy to answer that, should you wish.
Sure.
So at the orchard, there are what Department of Health epidemiology referred to as cohorts. There was 3 different facilities. There was 10 in one facility, 14 in another, and the remainder in the third. And this is at the moment contained to the third.
Okay. And when you say contained to the third, that's the 26 cases that are positive.
Correct. Correct. They're living at the third that I mentioned.
I see. Okay. And as far as the timeline, it sounds like if these positive tests occurred after that travel quarantine had ended, that sounds like it may have been something transmitted locally in Vermont. Is there an indication of how how this virus arrived at Champlain Orchards?
It's not clear, and I'll leave this to the health folks, but it's my understanding that the symptoms did occur within the 14-day quarantine.
And that is accurate. The index case symptoms began at close to the end of the quarantine period. So we have no reason to believe that it came from activity after that period was ended.
Okay, thank you. And then just kind of on a more general level, I know Alyson mentioned there were recommendations for air travel and chartering buses. Were there other specific recommendations that the state, or guidelines or recommendations that the state had for workers on farms across the state that were probably going to be living in very close situations?
I think the major recommendation was the 14-day quarantine period. And since this group was a cohort, if you will, had flown together, had driven on the bus together, and were now housing together, they were one cohort, all subject to the same quarantine guidelines, which were being adhered to.
Okay, thank you.
Tim McQuiston.
Hi, thanks, Ben. Anson, I'm wondering what the economic impact of this could be generally in Vermont, and how many migrant workers are there in Vermont? Do you know that right now?
Yeah, under this H2A program, and it's important, this is the H2A program, so these are all here legally. They've gone through the process of getting here. Correct me if I'm wrong, Alyson, but I think it's 325 total for this year have been approved to come and work in Vermont under the H2A program.
Okay, and I'm just wondering, if there's any. I know there was some discussion actually much before this about trying to get migrant workers into Vermont with everything going on. Have you found any economic impact from COVID and just the requirements required, the protocols? Is this fewer workers than we would usually have this time of year?
So I would be glad to answer that question. I think the fewer workers that you've identified are related to one orchard that is sold out that was large and used to get 50 workers, another orchard that has scaled back and transitioned and is not solely growing apples anymore, and therefore requests less workers. So previous years, we used to have just over 400 H2A workers. So likely the 325 is related mostly to those two situations. The H2A program, workers have been arriving pretty much on time all year, going back to those that arrived in February. So I think there was a period maybe in April where some were coming as late. For 2 employers, I believe, were affected where they were as late as 4 weeks. But for the most part, they've been arriving on time during COVID.
Okay, so you're not anticipating any further interruptions, because I know that as the workers come into in the winter also.
Yeah, that's correct. That's correct. None of the workers, all of the workers are here currently, and those that stay for to assist for harvest on the turkey farms, they transfer workers from various apple orchards. So those workers are already here in the state.
Okay. All right. Great. Thank you.
And Tim, I would just speak in general terms of agriculture, the impact of COVID. We do have some granting programs that are out there, and some of the applications that we have received, there are added expenses to comply with some of the things that are going to make their workers safe and comply with, getting best practices, distancing. It runs the gamut from, farmers markets to slaughterhouses to, pick your own. So there are added expenses that people are doing because of COVID, but those things likely can be covered under some of the relief programs that we have on the expense side.
Okay, great, thanks.
I had Malia, did you have another question? I saw your hand was up.
Yeah, I just wanted to clarify my earlier question about contact tracing. Dr. Kelso, you'd mentioned that based on contact tracing, the state's still determining if there's additional employees who were exposed, and that could prompt additional contact tracing. If those individuals are found to have been exposed during that time, could that pose any threat to the public, or is it still generally understood that the risk to public is pretty minimal?
Yeah, sorry if I wasn't clear. The contact tracing to identify who was potentially exposed is essentially done. So we don't expect to learn any more based on the cases we've already investigated. What we may find going forward the next week or so is that some of those contacts might become cases themselves. And so if additional testing results in additional cases, then we would do contact tracing around those new cases to identify who their contacts might have been. So again, we feel really good about understanding, how transmission might have happened and who might have been exposed. And we do not feel like there's any risk to the public at this point.
Great, thank you. And that's even if those additional exposed individuals come back as positive cases?
We'd have to see. It would depend, they're not cases as of today. And so they are likely not infectious as of today. So if they become cases, depending on when they have a positive test result or when their symptoms start, then we'd identify what their infectious time frame is and then look at who might be close contacts to them.
Great, thank you.
And if I could just add one point so that you further see the impact on the public. All of the cases have been isolated. When there are contacts, the contacts are quarantined. So the contacts are no longer in the public view, if you will. So they're not able to transmit infection because they're in an isolated setting themselves.
Great, thanks so much.
All right, that was everyone I'm aware of. Last call, any other press questions before we wrap up?
I have one more, Lisa Rathke at AP. So Dr. Levine, you said that you had offered, the health department had offered testing to the other workers. Did they all get tested, or was it their choice to get tested? And if they didn't all get tested, how many did?
I know we collected 101 specimens. So I think that would have taken care of pretty much everyone there.
Okay. And how many of those 101 are these H2A workers? Is it a majority of them? And just so I'm clear.
55 is my understanding. 55?
Oh, 55. Okay. Okay, thank you.
I've got one more question. It's Mike Donahue. So what's the difference between the 101 and the 55?
U.S. domestic workers and anybody within the neighborhood that would have been in contact. For instance, I believe there was some maintenance done in one of the housing facilities, and so those individuals were contacted too and offered testing.
And you said neighbors also from down that way?
I'm not aware of neighbors. No, I think that's the Department of Health, but it's my understanding that the employees were tested. And then there was somebody who did maintenance in one of the houses that I'm aware of that was contacted and did choose to be tested.
Thank you.
All right, folks. Thank you, Secretary, Deputy Secretary, Commissioner, and Dr. Kelso. I think we're all set. And good news, another press briefing tomorrow. This one's the governor, so you can ask your follow-up questions, Ben. Thanks very much, everyone.
Thanks, Ben.
Thank you.
Thank you, Ben.